Deadly fungi aren't just a thing of science fiction. Many of you have been watching the drama The Last of Us, which centers around a fungus that turns people into zombies. In real life, that fungus does exist, but it can't hurt us. You need to know there are rising cases of a real deadly fungus impacting hospitals and medical facilities right now. I talked with an expert about your risk of getting infected.
I think the reason why our healthcare providers were so concerned about this is because we're starting to see an increased number of cases throughout the United States.
CDC researchers blame the COVID-19 pandemic for the tripling in cases of a dangerous fungus, Candida auris. The report says hospital workers were strained by coronavirus patients, and that likely shifted their focus away from disinfecting some other kinds of germs. The California Department of Public Health says the fungus is a multi-drug resistant yeast that can spread in healthcare settings through person-to-person contact or contaminated surfaces and causes serious, hard-to-treat infections.
Patients who are at more risk for this are definitely patients who have diabetes or a suppressed immune system, have just had surgery, or there's any tubes or apparatuses that patients are using that allow the bacteria to get into the body.
For example, feeding tubes and breathing apparatuses like CPAP machines can bring bacteria or fungus into your bloodstream.
Once this fungus gets into our bloodstream, that's where it's really difficult for us to be able to treat.
The CDC emphasizes this fungus is not a threat to healthy people, but if you're visiting a patient, be sure to have good hygiene. Wash your hands, your body, and your clothes to help avoid spread. Healthcare provider Kaiser Permanente sent us a statement saying they've been aware of the fungus since 2021 and are working with the state health department to keep you safe, adding, quote, "The prevention effort within healthcare is part of a wider strategy against multi-drug resistant organisms."
So we have to be very careful about what we are giving our patients as far as antibiotics and antifungals to ensure that we're not creating a multi-drug resistant specimen.
This CDC map shows the number of cases of the C. auris fungus across the country. There were more than 2,300 clinical cases last year, 359 in California alone. We have a link to this interactive map and other resources on our website, abc10.com.